The following segment is sponsored by Oakview Medical Associates.
All industries are evolving and adapting to fit today's needs, and some of the greatest advancements and innovation are happening with telemedicine. Dr. Nita Bajura from Oakview Medical Associates is here. Hey, Dr. Nita, we've missed you. How have you been?
Hi, I've been great. How are you?
Good to see you. Well, at Oakview Medical Associates, you have found some ways to keep providing care, keep patients feeling connected, which you say is very important. Tell us how you're operating these days.
Yeah, so actually we've been open throughout this pandemic, and we have put some very nice protocols in place which have enabled our patients to really feel well cared for and very secure in such uncertain times. From the time they call us, we screen them over the phone. We have testing capability. We also, when we put we were one of the first few practices to put telemedicine in place, and that's been wonderful for us because it's just allowed me to have a very personalized connection with patients in the comfort of their home. It's really very easy. They just download the app onto their cell phone or their computer, and they can join the televisit. And it's really has been wonderful for us. We've really, from the time we've incorporated that, I think the numbers have gone up and patients are even more aware that we're there for them. So it's been great.
That's a great thing. And whether you're working from home, whether you're out of work, with or without kids, everybody's got a different situation to juggle. And Dr. Nita, you say we need to focus on our health even more right now. Why is that?
I think, because we've all been forced to slow down in a way. So we have the ability now to take inventory of our own health and, pay attention to our health more. So simple things like setting a time for exercise every morning, that is a wonderful thing. The weather is really nice, taking some fresh air. Another one would be breathing exercises. Breathe in 5 counts, breathe out 5 counts. Do that for about 10 counts, every hour or so. That really helps reset your energy for the day. Another one is, engaging with our friends and family through phone, emails, letters, and trying to minimize social media too much because it can get overwhelming. Another one would be just paying attention to what you eat. Now we have time to slow down so we can really plan our meals better. We're not rushing on the go, skipping meals. It's really a good time. I think it's a positive thing.
Absolutely. And, we talked about this earlier. It's really a time to be mindful. And you were telling me that you're hearing from a lot of people who are just finding this time to be successful. They're losing weight. They're working out. They're doing the things that maybe were put to the back burner before.
Right. We really have seen with our patient population that most of them that are doing telemedicine with us have actually lost weight, are eating better, have more energy, are getting the time to sleep that they've never had, traffic time, travel time. And now whether you're working from home, if you're working from home especially, you need to make sure you take breaks from the screen, get up, stretch your back, stretch your body, just to kind of reset you. And all of these things are cumulative, and I think they add up over the course of 2 to 3 months.
And finally, we want to safely go out and stay connected with one another. So how do we maintain that balance? And what do you tell people, your tips about going out and being safe about it?
I tell everybody follow the CDC recommendations, which are still to wear a mask when you go outside the home, maintain your 6 feet distance, between people. Also, hand washing, still very important. Whenever you come back into the home, make sure you shower. Just take precautions and just trying to be very mindful about everyone. Don't cough over, just make sure you cough into your sleeve, and things like that. Don't touch your face when you're out and about. So things,
Overall, it sounds like you think today is a good day to seize the time and make the best of a healthy lifestyle. Anything else that you want people to think about, or anything else we didn't touch on?
One thing I want to touch on is this time has caused a lot of emotional stress on people, loss of jobs, sudden change in the school environment, kids studying from home. So as parents, we have a responsibility to really be role models for our children. So just to be very mindful of that, be very positive, educate them in a very nice, kind manner, and also be happy, be loving with everybody, be kind with everybody. I think we've all gone through a sudden, uncertain time, and we will come out of this stronger. I firmly believe that we'll come out of this healthier, but it requires all of us to be very loving, kind, respectful for one another. And that's my message.
Absolutely. And I think a lot of people look forward to getting that message with you via telemedicine or in person. And you can get in contact with Dr. Nita Bajor. Oakview Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville. The number 627-0444. Dr. Nita, thanks so much for being with us, and we look forward to doing it again really soon.
Thank you. Thank you.